Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about leveteracetam. Leveteracetam has binding affinity to synaptic. It has binding affinity to synaptic vesicular protein. It has binding affinity to synaptic vesicular protein sp2a. Then the exact mechanism of binding is not known, but it may be by GABA or glutamate release. This levetiracetam also inhibits N-type of calcium channels. By inhibiting N-type of calcium channels, it will decrease the calcium release from intracellular stores. It decreases the calcium release from intracellular stores. So this is about levetiracetam. Thank you for watching.
Thank you and thank you for watching.